Thank you so much, Dr. Dwyer, for what was an incredibly interesting presentation. I'm just trying to digest all of the information that you presented. It was very impressive analysis, and I encourage people to submit their questions in the question box. Right now, we only have a couple of questions, and I have lots of questions. So I'll start with the questions in the question box.
Okay.
Can you share any information about how bioavailable the vitamins and minerals are in the MVMs in relation to the non-active ingredients of the supplements? For example, some people take the supplements on an empty stomach, some with food, some with liquid. Then there are the reports from sewage treatment plants about undissolved supplements clogging up their treatment ponds. So it seems that the formulation of the supplement for optimal absorption would be of concern too.
Well, it's a great question. It's a great question. And if you get a chance, talk to the folks at USDA and also down in Ole Miss, who do a lot of work on this. Bill Gurley is one expert at Ole Miss. Yeah, what you're talking about is what people in the trade, I think, call bedpan bullets. You know, these big supplements that older people take, and sometimes they don't get absorbed at all. With respect to the vitamins and mineral supplements that we're talking about today, we haven't done any direct studies on that. We have studied, the folks at agriculture actually have studied dissolution and disintegration, particularly for the botanicals, because those are a particular problem. It's my impression that for most of the vitamin mineral supplements, we're in better shape. I'm sure there are others at the conference who can give a better answer than that, but basically the things we're the most concerned about tend to be the botanicals, and there have been some tests of disintegration and dissolution, which are some simple chemical and physical tests for testing possible bioavailability. There are also some more sophisticated techniques that I know Dr. Harnley's laboratory has been looking at. There's one called the Shine, and I think there are others that are sort of artificial digestion apparatuses. And I know they're being used in some countries, and I think USDA is looking at some. Maybe there's some at FDA that I don't know about. So that's the best I can do on that question, but it's a good question.
Okay, great, thank you. Another person asks, notes that she or he really enjoyed your presentation. You covered SNAP benefit potential, but I'm wondering what your thoughts are on the costs of MVM compared to getting nutrients from foods, especially for something like vitamin D that's hard to get from food.
Well, that's a good question. The costs of those products, if you just go on the on wide web and look up the costs of some of these products, they vary from rather small cost to very high cost. And so I think I'm still of the old school of suggesting specific supplements. If the problem is vitamin D, then why not focus on vitamin D? You know, from my own standpoint, I take a calcium vitamin D supplement as recommended because I'm at high risk of osteoporosis. So that's what I would suggest there. It all depends on which supplement you're taking. For those who are consumers, I think the advice I give people and the advice my colleagues at Tufts Medical Center give is we suggest that they start with the generics. Some of the big drugstores sell a generic that's much cheaper than some of the more high cost brands.
Okay. Someone wonders whether you've stratified the supplements to look at those that target men versus women.
No, we did
rather than
not.
just adults in general? Okay.
No, we didn't do that. I think we're beating a dead horse if we look at those 2019 supplements anymore, because the market changes so fast. What I'd like to do now, because the new supplement facts label came into effect, everybody should have it on their labels now. The new supplement facts label has different DVs than the old one. The labels are probably much cleaner than they were when we did the study in 2019. So what we're trying to do now is to wait a couple of months and then draw a sample of labels that are all the new supplement facts labels. Take a look to see if product formulations have changed. Could be that the manufacturers changed things, and see where we stand today.
I don't even know how you keep up with the market and changing labels. You must have an army of staff to do that.
No, we have what do you call it? You know, the more automatic it gets, the better it gets.
Okay.
But it's a huge amount of work, and without Lila Saldana and Rich Balin and all of the other people who work on it for our contractors, we wouldn't be very far today.
Right. I really encourage people to check out DSLD. It's such a cool database. Someone else asks, is it still true that many prenatal MVM supplements do not contain choline and iodine?
Yeah, there are probably some. As I say, we haven't looked at the 2022 offerings, but choline was present in some and not in others in 2019. I think the worries for choline are mostly for pregnant women and young children, aren't they? I think the dietary guidelines mentioned it for those two groups. So those prenatals and supplements for children under the age of 4 would be where I'd want to see them first.
What are your recommendations on buying supplements that have been tested and certified by third-party testing organizations?
I think it depends on the third party. The third party certifications vary in a number of ways. Some are just focused on the WADA. If you remember the talk by, I think Andrea spoke the first day of the conference from the military. They've done a lot, and they recommend for their servicemen that they use supplements that have been certified, because they can be riffed from the Army and Navy and Air Force, I guess, if they have a substance in a supplement that's illegal. But I think in general, people are pretty well off for multivitamin mineral supplements with the big generics. I don't think it's necessary to go to the third parties, but for those who want extra assurance, maybe that's a good idea.
Okay. Could you speak to why zinc is listed as a nutrient of concern for excess intake?
Well, it's if you go back to the dietary, or if you go back to the DRIs, it's tricky. I think that dietary reference intake deserves a second look. And some people have suggested that it may, I think it's the zinc copper ratio that people are worried about.
Right.
But if you go back and look, it's there's several things that are a little strange about that. And so the list we took of the minerals of possible concern were from the major publications we could find, and that was often listed there.
Okay. Have any systematic reviews or meta-analyses focused on dietary supplement intake and health outcomes focused only on individuals who have known poor dietary intake or biomarker data showing low concentrations?
Well, yeah, of course, that's a great question. And the problem is that if only the people who took nutrient supplements were the ones who were deficient to begin with, we'd be all set. You know, that'd be a good thing because they would supplement the diet with a nutrient they were lacking in. The problem is that the people who take supplements in general, I think of a paper, some of you probably read it, I think Alexandra Cohen, who just got her doctorate at Purdue, did a paper on people who had low food security. And she looked, I think it was published in Nutrients, looked at intakes, their dietary intakes, and then use of supplements. And the point is the wrong people sometimes use these products. The people whose diets are already very good are the people using it. So it's difficult to tease that out. It's a good question, though, to look at some of the people who had a problem. I think one of the follow-ups of the Cosmos study, even though it didn't show a signal for cancer or cardiovascular disease outcomes, some of the cognitive outcomes seemed to have a signal. I think it was for older people who are men. I can't remember if it was sex specific, but there's some thought of trying to test that further to see if they can replicate the findings. So that would be a focus on a group that they thought had lower intakes and then see if it worked there. But haven't seen much activity yet.
Okay, interesting. That's all the questions from the chat box. I just have a quick question though. Do you know if any work has been done on looking at adherence to dosing instructions on the labels? For when we look at supplement safety, and we're generally looking at contaminants, not nutrients,
Right. Yeah.
In my group, we assume that people, to be on the safe side, we assume that people dose according to label instructions. We have no idea whether this is a reasonable assumption. There could be people out there who decide that doubling up is a good idea. And then there are people who just may take supplements every once in a while. And I wonder if there's any research out there that you know of looking at adherence.
No, not to the best of my knowledge. It's a great question. I think it's something we should look into right away. It may be that there's market research that somebody has, maybe some of the supplement companies have that research, and if they do it, it'd be great if they could share it. But I think during COVID, Judi, that what you've suggested may have occurred. People were, I don't know about you, but I was desperate. I couldn't get a mask. There were no vaccines. And, you really begin to think, well, what can I do to help myself? And what you turn to is whatever's around. And if it happens to be a bottle of something, you take more of it. I didn't do that.
Good.
I took more orange juice and maybe a little wine now and then. But
it's a good supplement.
That could be, I think that could be a very good researchable topic. And it's something that you could get a doctorate from. You really could do a doctoral dissertation on that.
Good suggestion.
And my hunch would be that it would be product specific, and that the real problems would be less multivitamin mineral supplements than some of the other products, which are condition specific. They're not only that, but CoQ10, whatever you have, all of those other products that are focused on conditions, if you will. We've just been doing some stuff with a couple of graduate students on diabetes. And I did a study a couple of years ago on cancer supplements. That's illegal. I mean, supplements don't cure cancer, but some of the advertising is very suggestive that they might. And I think people who have conditions, whether it's COVID, a cancer, HIV, whatever it might be, they turn to anything because they're not getting better. And so they're the big chance of overconsumption. And I'm much concerned, particularly with the cancers and the other diseases, because as you take more, you get into polypharmacy because you're already taking a whole bunch of chemotherapeutic agents and others, and you may get into interactions. We've seen that with St. John's wort, for example, with a whole bunch of different drug interactions.
Oh, interesting.
So it's a great question.
Well, thank you.
You've given me a new idea.
There you go. Thank you so much for such a wonderful talk. I have a million more questions, but we need to cut them off now to get.
This is such a great conference. Thank you for all you've done to organize it.
Oh, I was not the organizer this time. It was Thea Borean who organized it and others. But
been fun. I've enjoyed every minute.
Great. Me too. So now we need to break, unfortunately, to issue some awards, I believe.